Um, I'm Linda McElhiney. I work for a large health system in Indianapolis. We actually have 20 hospitals plus dozens of outpatient surgery centers and pain clinics and sports medicine. I'm here to talk about the hospital side of topical pain management. Most of our topical pain meds have to do with procedures. So we're doing a lot of anesthetic topical meds, but we also, since we have a sports medicine facility, we do soft tissue injuries and arthritic conditions. Since we're also connected with the IU School of Medicine, we get sometimes the worst case scenarios, the patients that have tried everything that's on the market and now they're coming to the med school to figure out what they can really do. So it's like patient-specific treatments. Our most common formulas for like procedures is, our most common one is LET gel, which is lidocaine, epinephrine, tetracaine, and that's usually for suturing. We also do nasal sprays and throat sprays too. For the soft tissue and arthritis, we do NSAIDs. We'll do topical NSAIDs with ketamine and or glucocorticosteroids. And then for neuropathic, it's really a mixed bag. It just depends on what the patient really needs. It's kind of prescriber driven, but it's also to meet the patient's needs, and there's a variety of different ingredients that can go into these. Now, one of the most profound topical case reports I've seen, we had a child that had a neuropathy, and this neuropathy was genetic. She was in so much pain, she couldn't use her hands, she couldn't use her feet, she couldn't feed herself, she couldn't work the remote on the TV, she couldn't walk, she couldn't go to school. And the doctors actually approached me with a case report. It was an adult that they applied 10% capsaicin. Now, capsaicin is usually less than 0.1% over the counter. They wanted me to make it 10% for this child. And it's so painful to administer this cream that they have to knock the patient out. So we actually made the cream based on the case report for this adult, but we were using it on a child and knocked her out for about half hour, 45 minutes. Put the cream on, left it on for half hour, and then they removed it and brought the child out of the anesthesia. The next day, the clinical pharmacist actually walked up to the unit, and as she was rounding the corner, here comes this same child who was bedridden, couldn't use her hands or feet, riding a tricycle, and she almost ran into her. So, I mean, that's how quickly it actually worked, the capsaicin. And this procedure had to be repeated every 6 months for like 2 years. But eventually, the patient could just use the over-the-counter topical capsaicin and a few of the systemic traditional meds that are used for her neuropathy. The information that I share with physicians, I usually get published peer-reviewed journal articles. That's how we kind of decide what we're going to start with these patients. And then based on that, I'll read it. There's a clinical pharmacist that's usually involved in it, and then we'll start recommending formulas to treat this patient. And then the physicians also are instructed in how to order, because we do have an electronic ordering system. Patients, we do the same. We share the same information that Mark shares with his patients: possible side effects, what they should do with missing doses, signs of degradation with the pain med, and contact information in case they start having problems. There's several ingredients. There's like 25 different ingredients in combination. In combination, there's probably hundreds of combinations that we can do for topical, neuropathic pain. Now, the bases we use for compounded, if you go to a box retail store, they might just decide to put it in Lubriderm or Eucerin or Aquaphor, but those really aren't designed to take active pharmaceutical ingredients. So what I usually recommend, there are manufactured bases that companies provide, and they do testing on it. They have absorption enhancers, And that's what I usually recommend to our doctors of what we should put it in. Or we use the pluronic lecithin organogels, PLO gels. And those actually, we used to have to compound that too, but now there's commercial bases that are available. And most of the manufacturers include PCCA, Humco, Fagron, Letco, and Mediska. And they usually do a lot of stability studies with different active pharmaceutical ingredients. So that's what I kind of base what I'm going to use to make their formulas. Developing formulas, of course, we talk to the physicians. Most people have medical team and clinical pharmacists. We look at published information. My job is to mainly look at stability information. So there's several references and online resources that I can use. This is actually the journal that Bob was talking about, and I'll pass that around. It has peer-reviewed stability information too and formulas. Then we select the base. We write our master formulation, so it's done consistently every single time. We follow the USP standards, and I'm very strict about that since I used to be on the USP. And if the compounded meds, if the physicians actually want them to use them in a protocol for a procedure, or if the whole health system decides that they really like the preparation, they will have to go through the P&T committee, and they kind of vet all that information out again, and they collect information to use to support what we're going to do. For procedural, the trends in our health system, most of it, like I said, is procedural. We do between 500 and 600 doses administered every month between our 3 hospitals that are downtown. One's an all-pediatric hospital. And for the soft tissue, arthritic, most of that's outpatient. I don't really see that much because the patients usually take them to the compounding pharmacies that are local to where they live. And neuropathic, we're starting to see, I'm starting to see a little bit more patients being started on this in-house and then going home on it. And something interesting is the doctors are starting to use these more and more in pediatric patients. I think it's because, you know, they're not having to take a bunch of oral medications where they're going to have more side effects, and it seems to be working in the pediatric patients, so they're starting them in the hospital and then sending them home on it. There's metered devices that Mark mentioned that we use. Actually, I brought some from our trade show that's going on, and I'll pass these around. They look like deodorant, you know, canisters, but they actually deliver like a 0.25, that one is a 0.5 gram dose. And so and the companies that make these devices, they're very accurate too. They're within 2 to 3% of the dose that's prescribed. Monitoring for safety and efficacy. Since I'm in a health system, it's very easy to do that because each patient is monitored and followed by a medical team, usually consisting of several doctors, a clinical pharmacist, and the pharmacy staff, nurses, dietitians, therapists, and even the med students. And so sometimes a patient can be followed by 21 different healthcare professionals and doctors. All the patients, all their medical records are actually electronic. So anybody in the health system that deals with that patient can actually go into the records and see everything. You know, everybody sees the same thing all across the board. Even the patients are given access to their own medical records through a different portal, and they can see what, you know, the doctors have, you know, concluded about their cases too. Once they're discharged, they're always followed up with a phone call, usually by a nurse within 24 to 48 hours to see how they're doing. And then usually before they're discharged, they're also scheduled for a follow-up visit, and they can also schedule visits through their online app too. And then most of the efficacy, you know, it's based on whatever pain scale that the doctors are using to evaluate the patient. Plus, it's all pretty much patient self-report. Now, if they start having problems, if they have, kidney problems, or they're, getting drowsy, and maybe there's too much of something in an ingredient, the doctor may order, lab tests to see what's going on. And that's all I have.